Welcome all to another Artificial Intelligence and Healthcare podcast episode. I am your host, Matt Kinn, Segment Development Manager for Healthcare here at Access Americas. And today joining us on the podcast is Yuta Endo. Yuta is the CEO and co-founder of Voxela. Yuta, for those that don't know you listening, why don't you explain or talk about the company a little bit and your role there?
Right. So, hi, my name is Yuta Endo. I'm the co-founder CEO of Voxela. And then Voxela's really vision and mission is make aging beautiful. So, and then we really leverage the advanced AI technology to constantly monitor the individual's physical strength, which is we're monitoring ADLs, the activity of daily living, to checking on the physical strength of individuals. So that way we can realize a lot of the advanced sign of the degradation of the physical strength much earlier than human being can catch it. So that way you can adjust your plan for the individuals. So that way that you can improve the QOL of the elders while you are reducing the overall operational burdens of the care staff members. And then which you can translate that you can actually reduce the cost while you are improving the QOLs of the individuals. So
that's fantastic. And it's a tricky subject in general.
Yeah.
Doing this stuff too. And then we're going to get into that. But I want to make sure I do the housekeeping things first here before we kind of dive into everything that we're going to be talking about here. But so for those of you joining the podcast series for the first time here, this is a podcast series around expanded dialogue, I would say, around the use of artificial intelligence models that find home in the healthcare industry, specifically for this podcast, the long-term care industry. And I very firmly believe that this type of expanded dialogue in general really lends itself well to providing context to the use of the technology, because if you're going to build out an AI-enabled program, you should really understand what it can and cannot do. And I think it's the best way to get it is just people talking like what we're going to be doing here. I want to talk about a few things, and we'll kind of let it roll where it may. But I want to talk about where we're actually seeing AI make a difference in improving outcomes, as well as I want to talk about something I know you're very passionate about, and I know that you guys do very well, is the summarization aspect, because I think that is game-changing in this industry, and not just long-term care, healthcare in general, but I think it's game-changing, and I want to make sure we get a chance to talk about that at some point in our time. But I think maybe what we'll do is we'll kind of explain long-term care really. What kind of why we're here talking about it. Long-term care itself is a very big umbrella from an aging at home or independent living environment to all the way to the other spectrum, like a skilled nursing environment. And there's a lot of levels of care, right? And there's a lot of levels even within that, right? That's that spectrum. It's huge. And there are similarities. And I think the similarities occur with the concerns. And the consistent concerns I hear, specifically from that of a resident or a resident loved one. I've experienced this myself, where they're moving into an aging care program, or they're escalating in the program or moving up based upon their needs. There's concerns. And I think the biggest one is probably the one that it gets talked about, but I don't know that it's talked about in these forums is, can I afford this? Am I going to be independent, depending on what level of care you're receiving or the community of which you're moving into? Does the staff care?
Right.
Do they even care? Are they well trained? Is there enough staff? I mean, that one we saw a ton of. I think we're still kind of towards the end of that, but it's still staff quantities are something that is just not very high right now. And so these are concerns that exist, I think, in a lot of people's minds, but I'm not in this space every day. You are. So can you kind of take us through what you're seeing as the major concerns? And it could be for staff or the resident.
Right. No, I think, Matt, you're right. So you touch up all the important actual subjects. So it's a challenge. It's the globe. This is not the North America challenge. This is not Japan challenge. It's everywhere. And then especially a lot of developed countries is facing this challenge all the time. And then the few challenges that I can name it, the one is exactly you mentioned, right? Staff shortages. And then also there are really it's also financial constraints. And then not from the people, actually residents paying for that service. That's also one. But also the financial constraint that I'm saying is not also the other side of the house, which is, like a skilled nursing home, assisted living facilities, who actually runs the care operations, care providers. They're also constrained a lot of financial challenges. So how we can make these things, like reverse, not the reverse, but how we can make them, profitable and healthy profitability so that way they can provide better services, they can reinvest the money for the staff members, care staff members, so that way care staff member will be much better trained. All those kind of stuff needs to happen, and that's a financial constraint in a second. And then also a lot of complexity involved. There like a regulatory complexity, and then also the family demand is getting complex. So all of those constraints and challenges, it's actually happening right now and everywhere. And then how you can solve those challenges is really that, as I mentioned earlier, that it's the thing is how we can make each care providers healthy, and then like a healthy and long-term wise healthy, and then profitability. So that way that they can do operation in a better way.
Yep.
But the challenge of the to make the more profit is they cannot increase the service fee that much, because then affordability is then our next question, is how you can reduce the cost is really what they're focusing on every day, right, in the daily operations. But the reducing a cost is not just simply like, eliminating people. You need more people because you have shortages in the staff members, right?
100%.
Especially like a skilled one. So how you can be more operationally efficient? That's really the question.
No, I completely agree with you too. And I think what you touched on it here too is that the loved ones at home are also factoring into some of these decisions. And I know that I want everything brought to me on my phone. I want, if there's something I need to know, I want easily accessible. I want to make decisions.
Right.
I want to be able, if they need to, fast.
Right.
I'm not saying rushed. I'm just saying I want data brought to me. And I think that's, so important too when you have like a loved one at home, understanding that they're getting the level of care for whoever's the resident being taken care of. That level of care is there. It's transparency as well too. So
yeah, transparency is definitely the key. It's a lot of times is really the black box. Just imagine you're driving a car and then you get into the accident without having a dash cam. That's nightmare. That is exactly happening right now in everywhere, not in the home, but in facilities and everywhere. And then that's challenge of that without having a dash cam in an accident. You're going to talk about the people with a very subjective manners.
100%.
And then it takes much longer cycle to close the deal. I mean, like not the deal, but close that, conversation. And then at the end, maybe in the situation getting worse, that people start having a lawsuit and here and there. That's cost you a lot. And then a lot of the irregular responses happening in a nursing home, and then those care, in general, like the care providers. Like if I look at the cost structure, let's say, because earlier when I said that when the facility needs to be profitable, now they need to reduce the cost. Now, if you break down the cost structure, you can divide it into only two. One is the daily essential cost, which is, your diaper change, all those stuff, and then, bath helps, and then also the meals, those are essentials. And then the other category is irregular responses. And then 70% of the irregular responses caused by the falls, and then a lot of things happen because people move. And then long time ago, the elder care facilities used to tie people on the bed. That's like a few decades away. And then, of course, you can't do that, right? No. It's not right things because human rights, right? But why they did that in a long time ago is because the people move, causing accident. Causing accidents creates a lot of challenges for care staff members, et cetera, et cetera. But you can't do that, right? And then moreover, you better encourage people to move, because the moving people around is great things because it's helped their cognitives, like all the things, recognitions, and then all that kind of positive effect can happen by people moving around, right?
It can be part of their care plan.
Exactly.
Of movement.
Exactly.
So where you want to encourage when you can, as much as possible. And what you're talking about of like tying down, I know what you're talking about. Like, I've seen restraints being used. It's not great.
It's not. It's the worst practice, to be honest. But
and I think it's mostly gone. But there, every now and then you'll see something interesting. And sometimes it's done for the care providers, for safety as well too. So I get it. But you mentioned something too specifically around falls, and we've talked about fall prevention models before on this. It is such a big challenge.
Right.
But when you start getting into an AI model that is specific for that of care,
Right.
adoption can be mixed because like the barometer of adoption is its accuracy. And specifically, it's not just necessarily accuracy of the model, it's accuracy of how they plan to use it.
Right.
So what do you recommend to people that are evaluating an AI model? It doesn't have to be false. I just use that as an example. What do you recommend them to do to evaluate these things before moving them into production?
Right. So I often see a lot of times this challenge of the adoption of the AI. It's not technology in general, I would say, is people overthink. And then people want to deploy things when they get the 100% confirmation of everything, which is not. Because technology evolves over a period of time while you keep using it. That's the beauty of the AI. AI keep growing. AI keep advancing because you are using it more. So it's a lot of I have a lot of customers, for instance, in Japan, who actually using our Vision AI technology in their nursing homes or skilled nursing homes, assisted living facilities everywhere. The common denominator across all those users is they deploy the technology as an investment, not the cost. Because often that people have like the old way to think about it, technology. Oh, you know what? I purchased this because it's cost, and then this is going to be how much you pay, and this is equal to translate as a cost. But sometimes people immediately ask me like, okay, well, what's the ROI on this one? Yeah, well, you can figure out ROI depending on what's your environment, all the situations, right? But at the same time, consider this as an investment, especially this AI world, that the earlier that you do, the better outcome you get over a period of time.
Yeah, and you talked about two things, and I want to unpack them with you, per se, in here. You mentioned too, I know you're a U.S.-based company, but you have found wild success in the Japanese market. And I think some of it has to do with, and again, this is speculative on my part, so just the culture. I mean, they're very family oriented. They have a ton of respect for elders. I think these are wonderful, admirable traits. But in your opinion, what could, and let's just not say America, let's say North America. Let's say the North American market. What could the North American aging care market really learn from the Japanese market?
Actually, it's a learning both sides, I would say. So Japanese nursing home also learning from the U.S. side of the house, and vice versa. But the thing is, the culturally, the Japanese nursing homes has a little bit more prevention and prediction prevention, that a little bit more proactive oriented rather than just reactive. When the fall happens, and then sometimes people think, one fall equals translate that how much cost that they have to pay for it. What's true. And then the question is, okay, how they can take care of those fall costs. I mean, like those costs cheaper. That's one side of one way to look at it. But the other way to look at it, okay, how you can reduce total number of falls of like the future. Maybe people fall more often in the future, but if you implement some like preventive actions, then people may not need to fall.
And I want to ask you about that too. So within how you see a lot of these systems get architected in the industry, is there a person watching these residents, or is it more the models doing it, the algorithms monitoring? I mean, how does that work?
Right. So that's what we are actually developing, like a Vision AI technology, to instead of people watching all the residents, which is impossible, right?
100%. Yeah, no, it's a lot.
Just imagine that's cost a lot.
It's a lot,
right? And instead of people watching
it's not fun either. You're sitting there just watching a resident population that's all asleep. It's not
crazy.
Great. That's not going to be a fun job.
Right, right. But instead of that, the AI to like watch the resident, that's way much more efficient and accurate because AI never get tired. AI doesn't need to sleep. So, but in order to get AI to monitor the individuals, I mean elders, the accuracy is really matters because accuracy is low. Then people get so many false positive alert. Then at the end, caregivers start ignoring alerts. How you can be accurate, and then how you can monitor it, and then how you can start realizing the gap between like where they used to be, and then they start slowly, declining the physical, strength, and then how quickly you can realize that. That's really also key.
And that's the other thing that I wanted to talk about. So that's a perfect segue for us. Is I want to talk about the visualization piece that I know you do very well. 'Cause in other conversations that we've had, we find ourselves kind of in this position where we're putting a lot of sensor data devices in a resident room or a home, and these are typically utilized to generate some sort of actionable data, whether it's going to be a LiDAR, a radar, acoustic sensor.
Right.
It could be a vision data device, a camera by another name. And these are typically tied to an operational efficiency program, like what you were talking about. Well, there's two sides to that coin. So most, and I would say the operational efficiency programs that I think are the most successful have some sort of business intelligence that they're getting out of it.
Right.
And that could be something as simple as staffing schedules, or it could be let's alter the care plan.
Right.
And so what I'd like you to do is unpack and take us through where you're seeing the biggest successes. And I think this is like groundbreaking for the industry.
Right.
Because now you have data to make a decision on that's not based on opinion.
Right.
And I'm not saying a human isn't making the final decision, because I'm a firm believer in that. But now we're giving them real data.
Right.
And so why don't you take us through that a little bit?
That's a great question, and that's a great point. So a lot of technology existed last centuries. Is really the sensors and all that stuff gives you the raw data, but it's not actionable inside data. And then the people has to mine a lot of data and then swamp all those data, and then at the end they have to make a decision at the end. Often those decisions may not be the right decisions, but because of the data is so raw, and then it's the way you're going to analyze those data is so vary, right? Right now, what you can do with the very advanced AI technology, with the current latest and greatest technology, is actually the AI can gives you the very intuitive data. I mean, like the actionable data. So that way, all you need is you have the option ABC. What do you want to pick? Which one you want to pick? Which one you think the best, based on your experience, based on that each individuals, you can pick that. So it's much quicker, better decision making process, and then it's a cost efficient decision making process. That's exactly you can do if you leverage advanced AI technology, right? So a lot of times it's the people doing a lot of sensors and some like even the basic things like radar lidar thing. It's detect like for instance people lay on the ground. Oh, it's fall. So it sends you alert detection. Oh, I detect people lay on the ground. So I send you a signal. Okay, what is this? How the person end up this situation?
Right.
You need to know entire story to take the best actions. But that part is big missing piece. The vision AI technology is actually gives you much deeper insight that not only just the moment that people fall, but the vision AI, like the advanced AI technologies, gives you the whole story of the summary of what happened last 30 minutes at your fingertips. So that way, when you run into the room to help the people to help the people, exactly how did it happen. Just like dash cam in your car when you get an accident.
Great analogy, yes.
Right, and then you see that that car is coming in because even though they have got the red signals, they're coming in and they hit my car. And then no complaints. I mean, like no argument, basically.
I mean, we've seen it too, where a resident that has an incident, they don't remember what led up to what happened, and so it's hard to provide the corrective measures correctly. And so you also talked about summarization too, and so charting, documentation is a huge time suck. It's a requirement.
Yes.
How is the summarization aspect? Because I mean, like you look at video, it's very unstructured.
Right.
Video data is very unstructured. So what people are doing in the video AI space, It's a lot of work.
Yes.
And so what the summarization aspects alone from a time perspective, I mean, what type like it kind of walk us through how that LLM stacks up.
Right. So what it can do is actually, as earlier I explained it, that detection versus actionable insight, like the data. The current Gen AI is really helps you to build that thing. And then our AI is actually doing that. So what we do is when the people fall, our AI completely understand how did that happens, which means we can translate that as in a transcript that write the report in whatever the format it is, because AI pretty good at it, right?
It is good at text. It's very good at text.
Right.
Yes. Text is darn good at. Yeah.
Right. But the challenge is how the visual information into that transcript or the text message. I mean, like a text report. That is the big challenges right now. But in order to do that, make that things happen, you have to train AI to give them a full story in every single cases. That's the reason why we constantly monitor a lot of different, like personnel's ADLs stories, so that way the AI understand how did this happened, and there are a few possibilities why this happened, and then which point the AI needs to closely look at. Like when people fall, you want to know, okay, if the person hit the head, and then how the person unbalanced, and then fall before the fall. All those kind of information is really critical. And then how the AI to constantly understand these points and then translate that and then put it into that kind of report fashion is really, really help save tons of their time, the operational time.
No, and I think that's, I mean, when you look at a chart, standard chart, there's a lot of space there for text, even if it's electronic. Maybe some places aren't all electronic yet. I think most are. Maybe a few places in the world that aren't. They have categorization ability for data, text data. Maybe some still images, video not so much now today. So it doesn't really exist. So like being able to summarize that, this is just a wonderful thing from a time-saving perspective. Because again, like you said, I want to make people more efficient. Because we don't have the numbers that we need for care. And if you're looking at just the U.S. population alone, we're looking at a pretty weird ratio right now of people moving into aging care versus care providers. And so we're seeing that with nursing staff on the clinical side, when I say like acute care side, we're seeing that as well too. So it's crazy. But so when I look at the use of an AI model for anything in a care environment, like you said, accuracy is the barometer of adoption. When I look at long-term care, we have a little bit of nuance here because it's not like going into the hospital where you're expecting certain levels of interaction, rounding, what have you, because sleep is actually like a huge thing. It's like a major problem people are looking to solve right now is how do I make sure people are sleeping soundly, because sleep is a huge portion of their care. And so, having constant people coming in is really not a great environment to be in if you're trying to sleep. But long-term care, I kind of look at it like a three-legged stool. And this is just my opinion, but I happen to think it's pretty darn close. And I've heard other people say this, just not exactly the way that, but it's like you're balancing, I would say, safety, independence, and privacy. Those are like the three, that's the three-legged stool. And so what do you recommend to people that want to utilize and get the benefits of utilizing an AI-enabled program, but maintain the privacy portion? Because I think we've addressed the safety and the independence aspect, but the privacy, because you're going long-term care, you're going into a resident's home, room, that's their private space. But you still, there's an expectation of those loved ones at home that people will be taken care of.
So privacy is the first things that people care, and then we care too. So we provide a full technology to protect all the privacy. So that's given. So, but at the same time, people sometimes think about the privacy too hard in a way. So that way they decided not to use the technology. That is something like for me is like that's you have to balance it out, right? Because of the privacy is important, but there is a technology to help cover your privacy fully, right? So then you have to give a trust to the technology to protect your privacy and then while you're getting the best care, like so, and then with affordable cost. So it's it's sort of like a lot of times that people think that camera in the room, or someone is watching in front of the monitor, just like a Mission Impossible, control room or something.
No.
But that is not the case anymore, because if you go to the nursing homes that in Japan, for instance, right, where they use our AI technologies, they don't actually have any monitor opened up.
Why would you?
Right, because no one needs to watch it, because AI is doing it
100%.
on behalf of you.
Yep.
So that is the first step, right? So it's so that's sort of like mentality questions that privacy camera, you feel like you're watching, you've been watching by the people, but now it's watching by the AIs.
And this is where, like, when we see like hospital remote patient monitoring differs greatly from that of long-term care. Like there's such a big difference because, like, in a hospital setting, you're going to have people there, and there is going to be people glued to those screens watching for falls. But that's a different type of care. This is more based upon independence.
Exactly.
This is there to provide safety and shorten response gaps. So when you say privacy, I want you just to unpack it a little bit more. I mean, are you using some sort of encryption? Are you using some sort of like blurring? I mean, like, how are you maintaining this privacy?
Oh man, we use all the possible technologies to protect the privacy. So of course, blurring is definitely the first things, right? Yeah. And then also that we use encryptions, all those, like the data securities, all those kind of stuff is already implemented. It's a given. And then great news is this last, like 5-10 years of the technology advancement, you get a lot of the latest and greatest technologies already accessible. And then of course we leverage all of those. So
Perfect.
No brainer.
No, and I think that's what people need to understand too, is that accuracy in this space matters. That factors into the safety aspect. The sensors are there to maintain independence and promote independence.
Right.
And they have to understand the people that are doing it, they're there for the best cause. And I think the way you explained it in the beginning was perfect for that on your mission. And I think that this is wonderful. Yuta, I can't thank you enough for coming on to the podcast. This is fantastic.
Thank you.
I'm glad that your travels brought you by us in the studio so we could do this. And
awesome.
For all of you listening in, thank you for tuning in today. Also, if you find this type of content valuable, be sure to check out the Access USA YouTube channel, likely where you're watching this, for additional type of content. Thank you all.
Thank you.